All right, Dr. Bruno here again. Today I wanted to touch on regenerative medicine, hopefully a series that I will be able to do today, mostly focusing on just an overview of what regenerative medicine is and what it means if you're interested in having a procedure that kind of falls under the regenerative medicine category, just explain, what your options are and kind of what the field of medicine is, and then in future presentations, future videos, hopefully touch more on the specifics of the different types of therapies. So again, mostly a quick introduction or kind of overview of regenerative medicine, and mostly focusing on what it means kind of within the sports, athletic, chronic pain world for individuals that have, kind of disabling pain related to some kind of degeneration that may respond to therapies involving regenerative techniques. So just want to touch on defining regenerative medicine and kind of what it is within the medical space. So Chris Mason did kind of define it as replacing or regenerating human cells, tissues, or organs to restore or establish normal function. So the central focus of regenerative medicine is going to be on human cells. And I would say that traditionally a lot of people may think of, embryo-derived cells, a very controversial topic, but you can actually harvest pluripotent stem cells, meaning these are cells that have the ability to differentiate into any type of cell depending on the environment that it's exposed to. And what that means is we can take it from your own body and put it back into your body. That would be autologous stem cell therapy. So you're taking it from your own body and then injecting it back into your body. There are some techniques for allogenic stem cell therapy, although that's kind of very new in being investigated at this point, and so really more kind of in the research realm still, but something that I'll touch on at the end here. And then just a comment, this is a field of medicine that is growing very rapidly. There's a lot of data coming out, so there's, I think, a lot of misinformation, but I think there's also a lot of potential benefit, and that's why I want to really provide some kind of information from what I've seen within the medical community, the pain management community, my own experiences, and then some of the research on these topics, because I think it's important to be able to make a informed decision if you are interested in proceeding with one of these procedures, especially since most insurance companies don't currently cover it, and it can be costly to have one of these procedures. So just to touch on quickly, the size of this field of medicine. I mean, you're talking potentially, $5.5 billion industry by 2025. So it's a huge field of medicine, and I think there's going to be a lot that we're going to see in the next few years about ways to use regenerative medicine to benefit patients. And then to touch on, the FDA's view of the world of regenerative medicine. So there's it's a much larger, view of what regenerative medicine encompasses. There are a lot of different types of therapies that kind of fall under that umbrella, but what's important, I think, is touching really on the cellular therapy. That's really the area of medicine that we use, or at least within regenerative medicine, to treat patients with chronic pain. Okay, so different types of procedures that we do offer within chronic pain medicine so there's going to be the platelet-rich plasma, which is one type of tissue that we harvest, basically uses blood draw and basically a platelet-rich plasma, as described, PRP, and we spin that down and we inject that back into the body. So that's one type of procedure that we can do and offer some pain relief through the anti-inflammatory effects of the PRP. Then a little more invasive procedure is going to be actual stem cell therapy. Typically, at least at the institution I work at, typically we do bone marrow aspiration concentrate. So that means that that's just one type of harvest that you can do in order to get those pluripotent stem cells to deliver back into the body, but we can also use, we can also harvest from adipose tissue, usually abdominal adipose tissue for that procedure as well. And then just at the end, I will touch on exosomes and microvesicles, which are actually, that fall into that allogenic stem cell category. So this is taken from usually umbilical cord blood or Wharton's jelly from the umbilical cord. So it's from, from somebody else, from a different tissue source, and then is injected into the person. So it's not autologous like the platelet-rich plasma and the stem cell, the adipose-derived and the bone marrow aspiration concentrate-derived stem cell therapies that we do offer. All right, so platelet-rich plasma, it's probably one of the most popular forms of regenerative medicine currently, and I think that's in part because it's very easy to do. It, as you can see in the diagram here, it involves a sterile blood draw and then injection into either a joint or a tendon, usually using some kind of image guidance, so ultrasound or x-ray guidance to get the injectate into the correct location. So after the blood draw, we do actually spin down the blood itself, and that's how the platelet-rich plasma is actually kind of separated from all of the other blood products, and that can be used then to, like I said, inject back into either a joint or a tendon. And I think one of the questions that people ask a lot is why are platelets important? Why do you use the platelet-rich plasma? And so platelets are actually very important in healing at a site of injury, and so they kind of the important things that they secrete are going to be growth factors. And there are a number of different types of growth factors that they secrete and kind of promote a healing response within either that joint or that tendon, and can help set up that environment so that that healing can then proceed. One caveat to all of this is that there is still a lot of controversy over the effectiveness of PRP injections. Unfortunately, there were a number of studies that when they first started being offered, there were a number of studies with really poor study designs, and so I think there's a lot of question about the effectiveness of PRP therapy. It's also, I think, probably overutilized in some cases, so you really need to identify the right patient and the right indication in order to have a good result. So there are some studies out there that have pretty good data, so and for specific indications. So lateral epicondylitis, which is going to be tennis elbow, which is a inflammation of some of the tendons in the arm, the tendons and ligaments in the arm, and then knee osteoarthritis. Both have actually very good data on PRP therapy in being effective in treating those conditions. And then also there's emerging evidence in trochanteric bursitis, or greater trochanteric pain syndrome, which is going to be hip pain, that PRP therapy can be effective in really giving patients relief and having and actually repairing or regenerating that kind of tissue that's in that bursa and that site, and patients can do very well. So again, that caveat, I think there's a lot of misinformation out there that maybe PRP doesn't work. I think there is still good data. I've seen a lot of, at least anecdotally patients that do very well with it. So I think for the right indication, the right person, it still is very effective. All right, and then mesenchymal stem cell therapy. So I think classically when people think of regenerative medicine, the first thing that comes to mind is going to be stem cells. So like I said before, the stem cells are autologous usually. That means that they're harvested from your own body. They can be harvested from the iliac crest usually. So that's going to be your bone marrow aspiration concentrate. We call it BMAC for short, and it's usually from the iliac crest because the marrow is easy to obtain from that site. There are places, and we have done it, that do lipoaspirate, which means it's basically a small amount of liposuction to pull off those fat cells that then can also be spun down, and stem cells can be harvested from that. From the marrow, or sorry, not from the marrow, but from the lipoaspirate that can be then used because there are mesenchymal stem cells in that that lipoaspirate as well. And again, with that, I don't want to get into too much detail. I think it's really, this is just an overview of what all of this is and what people are referring to when they say regenerative medicine. But just to kind of comment, I think it's important to understand why we use mesenchymal stem cells, and it's really because they possess two really important properties. So they have long-term self-renewal ability and the capacity to differentiate into multiple cell lines. So again, they're pluripotent stem cells, which means that they don't have any function at the time you're seeing them, but when they're put into a certain environment, they then differentiate into the cellular type that they need to be in order to be effective. All right, and then the last thing I wanted to touch on was essentially this idea of allogenic stem cells, and specifically exosomes. So the use of anything from umbilical cord has very little application to pain medicine, but this is one area there's a lot of research in right now, looking at the use of essentially the mesenchymal stem cells and the exosomes from from umbilical cord blood, and then also from the Wharton's jelly. And so here's just an image of an umbilical cord, kind of giving a sense of where there's an umbilical vein and then an umbilical cord artery where the blood can be, and these stem cells can be extracted from. And then the Wharton's jelly is essentially like it's like a gelatinous substance within the umbilical cord. It's similar to the kind of gelatinous substances inside the eyeball, and there are places that are harvesting the blood in the Wharton's jelly for these stem cells specifically. So the viability of live cells is extremely low when you start to look at this data, but there's evidence that they have these mesenchymal stem cell derived exosomes, MSC derived exosomes. And this is like going back to cell biology, what are exosomes? Again, don't want to get into a lot of detail. This is a very new area of regenerative medicine, but your body does produce these small vesicles that are derived from the cell membrane, and they actually are secreted by most cells in the body. So mesenchymal stem cells are just one type of cell that produces these exosomes. Every cell in your body pretty much produces exosomes, but these specifically contain very specific cytokines, proteins, lipids, and RNA, different types of RNAs, which are then thought to help with this kind of regeneration process and are possibly an alternative to the traditional stem cell treatments. So just another area that I think we're going to be hearing about a lot in the future, and I'll hopefully kind of give you some more information about it as well in one of these future talks. So I appreciate you listening. Please, feel free to check out more on my YouTube site and by going to any of these social media accounts. But hopefully that answered some of your questions about what regenerative medicine and pain medicine is, and I hope you enjoyed it. Thanks.